Ontario's largest hospital network will require mandatory and frequent testing for any staff who choose not to get vaccinated against COVID-19. The University Health Network, which includes Toronto General Hospital and Toronto Western Hospital, among others, will be the first major hospital and research organization in Ontario to create requirements around immunization for healthcare workers. The move comes as several countries have already made vaccination mandatory for healthcare personnel amid the rise of the rapidly spreading Delta variant. And with fear of a fourth wave, the lack of a mandatory immunization policy in Ontario has prompted some companies and institutions to formulate their own policies. UHN aims to implement new rules that will create testing requirements for unvaccinated personnel in its network by August 9. In an email to the Star, UHN said it began communicating its new policy to staff in late June, so all full-time, part-time or casual employees would be aware of its validity. We are implementing this to keep patients and staff as safe as possible. The best protection for anyone is the double vaccine, which has been made available to all UHN employees, said Jillian Howard, UHN spokesperson. Once the policy is in effect, staff must report if they are vaccinated, if they cannot be vaccinated due to a valid medical reason and provide documentation, if they do not wish to report vaccination status or if they choose not to be vaccinated. Everyone who is not vaccinated must complete rapid COVID-19 home tests 48 hours before their shifts, which is about 3 times a week, Howard said. Those who do not report their vaccination status or choose not to get vaccinated must complete a vaccine education module. Approximately 18,000 UHN staff members had already reported their vaccination status as of July 12, and 750 home test kits were distributed, according to UHN. The vaccination rate for full-time staff is now 85 to 90%, Howard said. We are now working to ensure that temporary and part-time staff are aware of the reporting requirement, he added. Last week, Ontario Prime Minister Doug Ford said he did not support the immunization test in any context. Ford said that no one should be forced to receive their injection. His comments came as several countries, including France and Italy, have implemented mandatory vaccination policies for those who work in healthcare. France also introduced a COVID-19 health pass on Wednesday, as infections have risen as the country faces a fourth wave of the virus. The pass requires a recent negative COVID-19 test or proof of vaccination in order to visit cultural centers, museums, sports venues and cinemas. The Delta variant has continued to spread across Europe. There is concern that the same could happen in Canada if hundreds of thousands of people remain unvaccinated, despite the availability of a large quantity of the vaccine. In Ontario, 80% of adults have received 1 dose and 66% have received 2 doses, as of Friday. The Star asked several hospitals on Friday if they plan to implement policies similar to UHN's. Mount Sinai Hospital said in a statement that it strongly encourages people to get vaccinated and that it recognizes that other public health measures alongside immunization, such as wearing face masks and physical distancing, are also crucial to stopping the spread. William Osler Health System, which serves Brampton and North Etobicoke, told the Star that as of June 7, all new hires must have at least 1 shot of the vaccine. However, it is currently not mandatory for other staff.